Long boots, blankets and scarves, all too familiar this season, right? Well, the winter season is officially in full swing. And of course, it also means that the sniffles and sneezes are also in full swing. But this year, doctors are warning of a stronger strain of flu. While there's no clear reason why, experts have also advised those who come down with the flu to take it seriously. But for more on this, I'm joined by Dr. Jason Magaela, a medical doctor and author this morning. And Doc, thank you so much for your time. Hopefully this conversation can assist either those who already have contracted the flu or those who haven't. Either way, it's an important one to have because you're saying this is a strain of flu that needs to be taken seriously.
Yes. It is a strain of flu that needs to be taken seriously because if we consider the past couple of years since the pandemic started, we see that we were more cautious in terms of wearing our masks, sanitizing, our cough etiquette was on point. But right now, because of the vaccine hesitancy and also because of people just being tired generally, we see that we're not as cautious as we used to be. Hence, now it's easier right now to actually pass on the flu that has been there before the COVID-19 pandemic. And unfortunately now, because of other people that are immunocompromised, for example, those who are HIV positive and those with chronic diseases, they tend to have the worser end of the current flu that we have.
Doc, I mean, oftentimes, as per usual, if we're going into the winter season, sneezes and sniffles seem to be a norm. But this time around, I mean, we are hearing of people gasping for air, not being able to breathe, sweating in this cold season, some having to be rushed to the ER because, it seems that this strain is much stronger than before. What do you think makes it different? Is it swine flu? Besides those who, of course, have comorbidities and, immunodeficiencies, but what could make the flu itself a lot more stronger this time around?
I think a lot of things have changed looking at the pandemic that we've had, and also leading to now with everything that we have. So the issue is that, like I mentioned before, because we are not as careful as we used to be. And also remember, leading towards the winter season, we used to take the flu vaccine normally before the pandemic started. So because now there are studies that have been done to show that because people have taken the COVID-19 vaccine, right now they don't see the need to actually take the normal flu vaccine. And usually that's very protective. It builds up your immune system. And hence right now we do see that it may seem like right now this flu is much more stronger than the previous ones that we've had. But it's just that, the way that we used to prepare for this winter season has declined as compared to the years before.
I'm asking this question as well because we're a country of memes and jokes, and some people can in our WhatsApp group say, Doc, is this a new variant of COVID that we're not aware of? I mean, are we going back to the lockdown days? But can you professionally tell us if there is any concern to believe that this might be a strange variant looming somewhere that South Africans need to really be cautious about?
Okay, it's not really a new thing because in terms of flu, there are two viruses that are known to infect humans, which is influenza A and influenza B. And they do cause like the normal symptoms that we see: a runny nose, coughing, body aches, headache, and you just being fatigued. However, it doesn't mean that it is a new strain. It just means that right now we're just seeing something that used to be there previously, which right now unfortunately we just need to deal with better. But it's according to the NICD, it's influenza A and influenza B. There's no variant that has been detected so far.
Right.
Maybe down the line there might be, but so far from the NICD, we haven't seen any record of a new strain besides the influenza A and influenza B, which have been known to cause the normal flu.
So let's about our viewers right now, especially before I let you go. You mentioned the flu vaccine being so important, even after you've taken, the vaccine before in terms of immunizing against COVID, etc. But what can we also do just to ensure that we keep away from this flu, if possible at all? If not, what can we do to protect ourselves? Because I mean, recently when I took my daughter to the doctor, and because her flu is, or her cough rather, is very phlegmy, she was advised against drinking more dairy, to drink less dairy, just, warm fluids to obviously manage the cold, amongst other things that the doctor advised. But what can you tell us in terms of dealing with this season right now?
Okay, for those who are not infected yet, we can make sure that, remember all those regulations that we had during the pandemic of washing your hands regularly, sanitizing your hands, and you can even wear a mask if you feel that you might be in an environment that where the influenza virus is, because it's mainly spread in respiratory droplets. And also what you can also do is to ensure that, like you said, having warm fluids, staying warm, and also taking some multivitamins as well will ensure that you boost your immune system. Especially vitamin C has been shown to actually boost one's immune system during this winter season. And for those that are currently affected with the flu, just make sure that firstly you prevent spreading it to other people by wearing a mask as well. And also continuing to ensure that you also wash your hands. And when coughing, you cough into your elbow, and to ensure that the surfaces that we have are regularly cleaned, especially if you see that you've been coughing, and make others aware as well. Because the same way as COVID has been spread through air droplets and landing on surfaces, it's the same way that the flu has actually spread. So we just need to make sure that we take care of ourselves to prevent us from getting the flu. And if you have it, we can make sure that you also do all those things from passing it on. And also for yourself as well, just make sure that you can either see a doctor as soon as possible, stay away from work as well, because rest and hydrating has been shown to be key factors in terms of dealing with, when someone has the flu.
All right. Well, Doctor, thank you so much for speaking to us about this, and appreciate your time this morning as well. Dr. Jason Magaela, medical doctor and author, telling us more about the flu season. Make sure that you do take care of yourself. And some of our, COVID or deemed COVID-based practices of washing your hands regularly, disinfecting, whatever you use, whether it's tables or machinery or equipment, whatever, sanitizing, those needs to still continue. This, of course, as Dr. Jason Magaela advises, that we should be cautious against infecting others, especially when we can detect that we have definitely been infected with the flu. But take care of yourself this flu season. It seems that those cluster outbreaks still seen in most of our schools and workplaces. So make sure that you remain cautious.